Well, the biggest expansion of health insurance since Medicare begins today.
More than 600,000 Wisconsin residents will buy private health plans through the new online marketplaces known as insurance exchanges, including those who are currently on the BadgerCare plan. So, have we lost you already? Well, our two guests are here tonight to try to help sort out some of the confusion about all of this. Donna Freidman is a researcher with the UW School of Medicine and Public Health's Population Health Sciences, and Kevin Moore is the Deputy Secretary of the Department of Health Services. Thank you both for being here tonight. We really appreciate it. Donna, it has been very confusing. So let's start with you, and if you can you give us sort of a broad umbrella answer about who is affected by this new law? If you're insured by your employer, is this something you have to worry about? Who is this targeting?
For the most part, people who are currently insured by their employer are not going to be immediately affected or specifically affected by this law, although there will be some macro changes in the healthcare system generally that have been happening over the long term. But this law specifically is affecting the uninsured population, and then because Wisconsin has some policies underway, people who are currently enrolled in BadgerCare, a segment of them are also going to be wanting to pay attention to this law because their status is changing relative to BadgerCare. So it's primarily the uninsured in the state and a segment of the BadgerCare population that are going to be specifically affected.
Kevin, let's talk about BadgerCare. That's your expertise here. What should people do? What do they have to do?
I think for the most part, we've been communicating to individuals that are going to be going through the transition time. So as Donna mentioned, there is a group of individuals that are currently in BadgerCare that will now be getting access to affordable health insurance through the marketplace or through the exchange. We're communicating with them. We'll follow up with phone calls as well. Then there's also other people that are uninsured that are part of the core list, which was the wait list to get on the BadgerCare Plus program, specific to childless adults. Again, they will be contacted as well. So really, I think to mirror what Donna said is just stay tuned, listen to what's going on, and from the department's perspective, we're going to be doing a lot of push contact information so that they're aware of what they need to do to make sure that they're covered on the 1st of January.
So the state will contact each individual?
We've done it. We've been sending out letters the last 2 weeks, and we'll continue to do that. We've also got a phone center that will be also communicating with these people as well, just to follow up. It's just to make sure that we're covering all of our bases for these folks.
We're using words, I think, that sometimes are confusing. Is marketplace and an exchange the same thing?
The exact same thing.
What does that mean, Donna?
So what we have now is a place where in Wisconsin, Wisconsin has decided to defer to the federal government to run our marketplace. But what it is a place where a number of insurance plans will be provided using the same criteria with regard to the kinds of benefit packages that are offered and the kinds of rules that they're operating under. And people can go online or use an assister to help them sort through the plans and basically do an apples-to-apples comparison so they know what they're looking at and enroll in coverage using like I said, the assistance or the online resources, and then have access to some financial assistance if they're within certain income categories, up to 400% actually, or 4 times the federal poverty level. They can get financial assistance to purchase coverage through this marketplace.
We asked some of our Channel 3000 Facebook viewers if they had any questions about this, and Amy asked, why is it mandatory? My mother hasn't had health insurance for 25 years, nor has she been to the doctor. Now at age 54, she'll be penalized for this. This seems unfair.
This was one of the core tenets of the Affordable Care Act, and the whole goal was to try to get as many people into insurance pools, and so that's been also known as the individual mandate. It's something that has been in the news lately, and that's something that everybody needs to be aware of, because if they don't have coverage by the 1st of January, there are these penalties that the Internal Revenue Service can actually levy if you don't have insurance coverage.
And what is the timeline for signing up for this?
So the marketplace opened today.
Right.
Actually, that's why you're hearing about this in a lot and here today with us. And there's an open enrollment period that goes through March 31st of 2014. So people can go and sign up for coverage anytime in that 6-month period. But if they want their coverage to begin by January 1st of 2014, they're going to need to sign up in the marketplace by December 14th.
And if you ever get into the
So-
marketplace with all the glitches today, there's 4 different kinds of insurance you can buy.
Yep.
Yeah, well, and actually there's the 4 that we hear about, but there's also a catastrophic plan for younger people who may not feel that they need the full kinds of coverage that's available in those 4. So there's a less expensive catastrophic plan as well for younger people. Now, let me just reassure you, because there were glitches today, that this will be worked out, and people should, this is the first day, and there were 2 million people, I believe, in the federal marketplace website by 2 or 3 o'clock this afternoon. It will be worked out, and people should not get discouraged. They should keep going.
But if you have insurance now, you're pretty much set. You don't have to worry about this.
For the most part, yeah.
For the most part, yes.
And what is the main state resource where people can go to get, because we obviously didn't get a chance to cover all the questions today.
Of course. I think the big thing is for people who have questions, healthcare.gov continues to be the best portal. For people that think that they're eligible for Medicaid or for the BadgerCare Plus program, your county eligibility system, your income maintenance offices is another term. Continue to use those. We're actually seeing an uptick in volume because people are asking questions, and so that's where they should get that
And we have a
resource.
special section on channel3000.com on the health tab, and all the questions are there and answers, hopefully, as well. Thanks for being with us.
Thank you
today.
so much,
Thank you
guys.
very
We'll
much.
have you back soon as we continue this conversation.
Pleasure to be
We
back.
really appreciate it.
Yep.